Welcome to this video on angina pectoris, a clinical overview and management. We will cover the pathology, pathogenesis, diagnosis, and treatment protocols for this cardiovascular condition. Angina is a term for chest pain due to reduced blood flow to the heart muscles. It is a key symptom of coronary artery disease, often presenting as pressure or crushing pain. It is a critical warning sign that an individual is prone to cardiac arrest, heart attack, or sudden cardiac death. Angina is categorized into three types. Stable or chronic angina occurs with exertion and is predictable and relieved by rest or standard medication. Unstable angina is serious, occurring at rest, often unrelieved by medication, and indicates a risk of imminent heart attack. Variant or Prinzmetal's is a rare type that occurs at rest due to blood vessel spasms and is relieved by medication. Coronary artery diseases, or CAD, are the most common cause of angina. Primary risk factors include diabetes, elevated cholesterol, high blood pressure, and smoking. Other conditions that increase oxygen demand on the heart, such as physiological stress, aortic stenosis, and hypertension, also contribute to the etiology. The pathogenesis, or ischemic cascade, is summarized by the statement: when the oxygen demand exceeds its supply, it results in myocardial ischemia. Primary factors reducing oxygen supply include stenotic atheromatosis disease, coronary arterial spasm, arterial thrombosis, and inflammation. The root cause is often arteriosclerosis, where cholesterol plaque narrows arteries by 50 to 60%, reducing blood flow and causing chest pain during stress. The primary presentation of angina involves heaviness, pressure, squeezing, tightening, and pain across the chest, localized retrosternally. The pain can radiate to the arms, back, neck, jaw, or teeth. Secondary symptoms often include a cluster of autonomic and gastrointestinal complaints like weakness, heartburn, cramping, indigestion, sweating, nausea, and shortness of breath. Angina-related chest pain can severely restrict daily physical activities. Untreated or unstable angina has critical secondary pathologies, with heart attack and heart stroke being the most dangerous complications. The diagnostic toolkit includes physical examination, ECG, stress tests, chest x-rays, coronary angiography, and blood tests. The main treatment objectives are reducing pain, preventing active symptoms, and lowering the probability of a heart attack. Non-pharmacological approaches include smoking cessation, strict weight control, pacing and dietary changes, cardioprotective nutrition, and effective stress management. Pharmacological management involves several drug classes. Nitrates dilate coronary arteries to relieve acute pain. Beta blockers decrease systemic blood pressure and slow the heart rate, reducing workload. Calcium channel blockers are used when beta blockers are contraindicated. Finally, antiplatelet drugs prevent blood clot formation, reducing the risk of heart attacks and strokes. For severe or unstable angina unresponsive to medical treatment, surgical intervention may be required. Angioplasty is a procedure that involves deploying a stent to physically hold a narrowed artery open. Coronary artery bypass surgery, or CABG, involves grafting a healthy vessel to create an alternate pathway around widespread blockages.